So, very good evening to all of you. I am Dr. Sanjeev Chopra, uh, consultant at my own hospital, Chopra Nursing Home, working for last 18 years. So, today we are going to discuss a very interesting topic, that is pedal edema and CKD and its causes, symptoms, and treatment. We will all discuss all these topics today's. So, first of all, welcome to today's session on pedal edema and chronic kidney disease. That's we call CKD. Today we will explore what pedal edema is, its causes, how it relates to CKD, and the best way to manage it. First, let's see what pedal edema is. Pedal edema is a condition where extra fluid accumulates in the lower legs and feet, causing them to swell. This swelling can happen for several reasons, such as heart problems, liver problems, thyroid issues, kidney problems, or blood clots. So our body fluids are divided into two main areas, inside our cells and outside them. The outside area includes the space around our cells and inside our blood vessels. Edema or swelling occurs when there is problem with low fluids are distributed between these areas. So this is when unequal means amount of fluid is accumulated. So this problem happens if too much pressure builds up in the blood vessels, often due to the heart issues or excess fluid in our body. It can also occur if there are enough protein in our means lack if there is lack of protein in our blood, like albumin, which helps keep fluid in vessels. Additionally, the lymphatic system normally helps move extra fluid and proteins back into the blood. But if this system is not working properly, fluid can build up and cause swelling. So these are various means causes that can cause pedal edema. So the kidneys plays a crucial role in regulating the body fluid balance. As we know that the kidneys helps remove waste and regulate fluid. When they are not functioning properly, fluid can accumulate, leading to edema as seen in CKD and acute kidney injuries and nephrotic syndrome as well. Edema is one of the major symptoms of CKD. Let's explore how clinician approach the diagnosis of edema. So first, a detailed history helps identify risk factors and underlying conditions like heart failure, kidney disease, and thyroid disorders. Uh, Edema can be generalized or localized. First of all, general edema, if we talk about that, this type of edema, the entire body or large area of it's often linked to the conditions such as heart failure or kidney failures. And on the other hand, localized edema, this type causes swelling in just one area of the body. It is often due to inflammation, blocked lymph flows, or issues with blood flow in the veins, especially. So during a physical exam, clinician look for pitting edema, intense after pressure, indicating heart failure or nephrotic syndromes. So pitting and non-pitting edema, these are means two different edemas. Wherever in non-pitting edema, just lymphatic obstruction or hypothyroidism. So the non-pitting edema is more common in thyroid and lymphatic problems. In the case of renal diseases, the following lab tests and images are helpful, like CBC, renal function test, especially creatinine, urine analysis, microalbuminuria, and urine albumin to creatinine ratio, as well as an ultrasound of abdomen and pelvis. History and physical examination are key, identifying the systemic causes and specific science guides the management of the plan. So when it comes to the managing the pedal edema, to managing edema, the approach depends on whether the cause is local or systemic. For local causes, non-pharmacological treatments are essential alongside addressing the underlying issue. For systemic causes, a combination of general measures and targeted treatment is needed. For local edema, non-pharmacological measures include limb elevation, compression therapy, like wearing compression stockings and can assist it improving blood flow and the regulating edema. Physiotherapy, ice applications. These are some non-pharmacological measures that can with that we can manage uh, edema. On the other hand, in case where systemic causes are there, like CKD, treatment focus on reducing the fluid retention and addressing the underlying condition. This involves salt restrictions. Limiting salt intake helps prevent fluid buildup and manage volume overload. So we can, by reducing the salt in our diet, we can manage uh, the edema. And on the second thing is diuretics. These are medications that increase urine output to help manage fluid levels. Different type of diuretics are available, like loop diuretics, thiazide, potassium sparing diuretics. In loop diuretics like furosemide and taurosemide, we often prescribe these medicines, which are very, very effective in long duration of action. Thiazides, metazolone, like medicines which are available, use additionally to enhance the diuretic effect. And thirdly, the potassium sparing diuretics like spironolactone used cautiously due to the potential of high risk of hyperkalemia. So these can cause hyperkalemia. The choice and dose of diuretics depends on factors like the severity of edema, patient's hypodynamic status, and kidney functions. It is important to use diuretics cautiously to avoid complications like hypokalemia, hypotension, and electrolytes imbalance, which is very, very common in these deaths. And regular monitoring of fluid volume, urine output, blood pressure, weight, and periodic tests is very, very essential. In chronic kidney disease, managing edema often requires salt and fluid restrictions, high dose diuretics, which are very is required in CKD, loop diuretics, especially furosemide, are usually effective, but thiazide diuretics can be added if there is need of these drugs. Patient education is very, very crucial. Understanding the condition, following the treatment plan, and making lifestyle changes can improve outcomes. Early recognizing and effective symptom management helps prevent complications. So join us in recognizing National Edema Awareness Day on September 25th of increase awareness and promote early detection edema related conditions, which is celebrated every year. Together, we can manage the understanding edema better, manage it, and this is very, very crucial to be together and fight this problem. So thank you so much to all of you for listening.